Good morning, everyone. I'd like to welcome you to NB Lung's 31st Annual Respiratory Health Symposium. I would now like to take a moment to welcome Melanie Langille. She's our CEO, as mentioned. She's going to be talking about radon gas and lung cancer in New Brunswick. And just to give you a little bit of background, Melanie holds a Bachelor of Science in Biology from the University of New Brunswick and a Master of Environmental Science from the University of Toronto. She worked for 12 years in environmental consulting, reporting for a wide variety of environmental impact assessments, contaminated site assessments, human health, and ecological risk assessments. With a technical expertise in vapor intrusion, she led the development of standards for soil vapor intrusion investigations in Atlantic Canada under the Atlantic Partnership in Risk-Based Corrective Action Implementation Committee. Whoa, that's a mouthful. Since joining NB Lung in 2019, Melanie has focused on public education and policy advocacy in environmental and lung health. And with that, I would like to turn the screen over to Melanie.
Thanks, Sarah. Yeah, the Atlantic Partnership in Risk-Based Corrective Action Implementation is acronymized as Atlantic PERI, so it's an acronym within an acronym, which is always super fun. So I was going to say thanks to NB Lung for having me, but they kind of don't have any choice. I am here all the time, and I love to talk about radon. So let's get going. Like Sarah said, I'm a little bit of a science geek, environmental science geek. Particularly when it comes to the human health risks of things that are in the air that we breathe. And I've been with NB Lung now for almost 5 years and kind of turned that lens around from the assessment of contaminated sites where we look at, do we need to clean this up, yes or no, to, yes, we really should because of a number of risk factors. So radon is a serious lung cancer risk. So let's get right into it. Radon is a naturally occurring radioactive gas. Now you can't see it, smell it, or taste it. It's formed by the breakdown of uranium, and uranium is found in soil, water, and rock. As that rock breaks down, it releases radon as a gas. It can escape from the ground. It can get out into the outdoor air. In the outdoor air, it's diluted pretty quickly, and we don't really worry about that. But in an enclosed space like a home or an office space or anything where people are spending a lot of time indoors, we can be exposed to quite high levels of radon. And this is a serious health risk. We typically focus our efforts on residential radon because people spend a lot of time in their homes. It's not to discount workplaces, which is also something that we do encourage workplaces to test as well, so that they know what's in there for their workers that are spending 8 or 10 or 12 hours in a day. But inside, in the indoor air, radon goes through a series of decay steps, which turns it into radioactive polonium and lead. These are actually solid particles that get kicked out of the gas. And those solid particles, as they're kicked out, when that happens on the inside of your lungs, they can damage that really fragile lung tissue. And then those solids that are radioactive in and of themselves remain in your lungs and continue to go through some more decay products, which continue to provide radiation on the inside of your lungs. Alpha radiation in and of itself is typically not very strong when we're talking about various radioactivity. If I were to hold up a piece of paper, I could block those alpha particles. But my lung tissue on the inside is not as strong even as a piece of paper. This sequence here shows a little bit of the sequence of events from alpha particle radiation and how it leads to cancer. Now this happens from, there's a number of mechanisms by which we can develop lung cancer from this radiation. All boils down to cellular damage. So that can be within the double-stranded DNA. It can be within forming reactive oxygen species that can cause inflammation across the body and oxidative stress. I love this slide because this is a literal picture that we've taken with our partners at the lab that we partner with RPC that does our radon lab testing. When you do a radon test, what it is, it's a little plastic puck, and I should have grabbed one for demonstration purposes, but inside that plastic puck is a piece of specialized plastic film. And as that radioactive decay happens and the particles are being emitted from the gas, the particle actually makes these little ding marks in the plastic. And the lab can literally count them. And based on how long that detector was out in the home, they can calculate the concentration of radon in the air that detector was exposed to. But we put this beautiful green filter on so you can see a little bit better what that decay looks like. Oh, thanks, Connor. Look, here's a radon detector. So it's just a little plastic puck, super simple to test for radon. You literally just take this out of the package and put it somewhere in your home. I can put it on my shelf right here. And 90 or so days later, send it to a lab and they can look at that decay sequence and the little dig marks in the plastic. So you can just imagine if that radiation is enough to make those dings in the plastic, what's that doing to our lungs on the inside? One of the really cool things about radon is that Canadians discovered it. It was discovered in 1899 at McGill University in Montreal. So we've known about this for quite a long time. In 1988 is when the World Health Organization classified radon as a group 1 carcinogen, which means they have enough evidence to determine it has a well-established link to lung cancer. Now in New Brunswick, we have some of the highest radon levels in the country. That's based on I wouldn't get into that in a couple more slides here, but we have the second highest radon levels in the country with the published studies that are out right now. Now there are new ones slated for release here soon, but the most recent ones that are published states about 1 in 4 homes have dangerous levels of radon. Important thing to note here with this map is that these results are aggregated data from one of our partners. It's not a full data set. And also you could not zoom into this map down to the house level and determine who has tested their home for radon and who hasn't. These are aggregated at a 3-digit postal code level. So, you know, the most definition you'd see in my result is it's north side of Fredericton. So this is a map that was part of the most recent, so it's a 2012 Cross Canada Radon study put out by Health Canada. It's a relatively small study. I'm really excited to say that there's new data coming out this fall, and we've contributed to that research study. So it's a more robust data set. But at the time, they delineated the province based on our health zones and the percentage of homes that had some tests done in there that exceeded this action level from Health Canada. So it does vary a little bit across the province. And you know, we don't have the data set overlaying here because it's just too much information. There's about 800 and some data points that went into this study, but you can see it is a little bit different depending on which area of the province that you're in. Why? It's based on our geology. So I talked about how radon comes from uranium-containing bedrock. New Brunswick just so happens to be really, really high in that kind of bedrock. We also have not very much soil between our basements and the bedrock. So in places further west of us, it can be meters and meters and meters and meters of soil below the surface before you hit bedrock. In New Brunswick, we have a number of homes that we have to jackhammer the bedrock out to even put a basement for our home. So we're really, really close to it. Not much space for things to dilute before it can get into our home. So if you really want to geek out on the geology, this is a really big detailed map of the bedrock in geology. When I worked in consulting, we had these printed really massively so you could actually see the different bits here. But the takeaway is that the types of bedrock that are most commonly associated with high levels of radon are the ones that you see here in the blue-ish, green-ish, light-ish type of coloring. So you see we have quite a bit of variation in the bedrock across our province. But there are some areas where it tends to be, you know, higher risk statistically based on that bedrock geology. Now, how does radon go from being in the soil or being in the bedrock in the soil and coming into our house? This is what I have spent a lot of my career in looking at, is how that vapor moves from the subsurface and into the surface. The Coles Notes version is there are cracks in foundations. Doesn't matter if it's a brand new foundation, it looks in good shape or what, there are cracks. Typically, a brand new build, you'll see a perimeter crack where the soil slab meets the footing of the foundation. And there's also cracks where we punch holes for pipes and drains and all sorts of things. We are creating pathways for that vapor to come in. Add to that, as homes get older, things tend to settle, more cracks happen. So more homes, some homes are higher at risk than others. Some homes have dirt floors or a big open sump pit or rock foundations. These are all vulnerabilities to that radon being able to come in. Another piece of that is how the building itself breathes. You may know a little bit about ventilation in a building. We want to keep the warm air in. We also don't want to have too much moist air stuck inside the home. We get condensation on the windows and things like that. So we do try to ventilate it to a certain extent. This varies a lot, house to house to house to house. Some of the energy efficiency measures that we put into place in our homes can actually impact how the building itself sort of breathes in and out, if you will, with the outside air and the soil below it. So Health Canada actually released an official statement on radon and energy retrofits in October of last year, citing research showing that the measures that we take to tighten up our houses can also inadvertently cause up to 100% increase in indoor air radon levels. So it's something to be super mindful of if you're doing renovations to your home to make it tighter. That's great from an energy efficiency perspective. You just want to make sure you're checking that radon after you've tightened it up. Whoops. Oh, goodness. Pardon me. So we know we have really high radon in New Brunswick. We know it can get into any and all homes. We also know that the cancer prevalence is higher in the Atlantic provinces compared to the rest of Canada. So who's at risk for lung cancer, radon-induced lung cancer? Well, really everybody is. Radon is the second leading cause of lung cancer in people who smoke, is the #1 leading cause in non-smokers. There's a misconception that that smoking is really the only way that someone can develop lung cancer. It's certainly not the case. We see an unfortunately large number of individuals that have never smoked a day in their life, never spent any time in a secondhand smoking environment, and are diagnosed with late-stage lung cancer. Excuse me. So if someone does have a history of smoking or is exposed to secondhand smoke, that risk is even higher. Now, for years and years, we talked about radon being a lung cancer risk, and that was the only thing that we were focusing on. There's a number of new research studies that are suggesting that the inflammation responses that the body has to long-term radon exposure might also lead to pulmonary fibrosis and ischemic stroke. So this is something that's not going away. We're starting to understand it more and more and more. And it's certainly a concern for the respiratory health community. By the numbers, here's some very sobering facts from New Brunswick. As of 2023, we see lung cancer is the leading cancer in New Brunswick. Almost half the people diagnosed with lung cancer are not diagnosed until the cancer is at stage 4. And by then, the 5-year survival rate's below 5%. Number of reasons why we wouldn't be thinking about lung cancer as being the potential cause of the person's symptoms if we don't have any any history of smoking in the patient or family history of lung cancer, no secondhand smoke exposure. Lung cancer may or may not be on our radar, but I want it to be on your radar because everybody is exposed to some level of radon in their home. And if we haven't tested it, we don't know if it's high, and our risk for lung cancer is that much higher. Lung cancer accounts for more cancer-related deaths than the next 3 leading cancers. That's prostate, that's breast, that's colorectal combined. And lung cancer is the #1 cause of cancer deaths in New Brunswick. So it's over 28% or more than 1 in 4. Now, if you really want to geek out on this data, StatsCan has a customizable data table that's really user-friendly if you want to play with that. These statistics come from a combination of Statistics Canada and the New Brunswick Department of Health and the New Brunswick Cancer Council. The NBIRDT published a study in October of 2022. We know that each case of lung cancer that hits the medical system in New Brunswick costs the medical system about $70,000 per person per year of treatment. And then flip side of that is we know that lots of lung cancers are not diagnosed until that cancer is stage 4, which is very advanced, and the prognosis is really not good. So at MB Lung, we're trying to get ahead of this curve. We're trying to prevent preventable lung cancer by testing and fixing homes that need it, and helping to get radon on the radar of the medical community, so that if someone is having some respiratory symptoms, we're not sure what it is, they're not a smoker, I don't want you to rule out lung cancer as a potential cause of their symptoms. When it comes to risk factors, not every person is going to be at the same risk for lung cancer induced by radon. We need to know, or one of the pieces of the puzzle can be how much radon is in the home. It's different whether it's 200 becquerels per cubic meter or as 1500 becquerels per cubic meter. The risk is that much higher, the higher it is, and the longer that you've been exposed to that radon. So someone that moves into a home with high radon, they identify it and fix it within a year. That's a whole different ball of wax than somebody who has lived in their house for 65 years, just tested for radon, and it's off the charts. So at the most basic level, the risk to a person, you can kind of conceptualize it as the hazard being the intensity of that radon level times the length of exposure. So I talked about testing a little bit. This little doodad right here, it's super simple. I could give a whole other presentation about testing and mitigation, but just high level here today. The take-home message is testing is really easy, and homes that have high radon can be fixed. So the only way to know if you have a high radon level is to test it. We encourage every single home to be tested. I don't care where you buy your radon test kit, but we are a provider of them that are certified through what Health Canada recommends, which is the CNRPP accreditation. And we recommend that you do a long-term test, which is over 90 days, to get the best picture of what's going on in your house, because things can fluctuate day to day, week to week. We want the biggest picture before you decide that you might need to do some repair work. So stay tuned. We're working on an Atlantic-wide radon awareness campaign that'll be hitting our social media in October. If you would like some resources for your practice, for your personal use, what have you, please reach out. We're happy to share all the resources we have. Best way to reach us is info@nblung.ca, and just put in the subject line radon, and we'll get you what you need. So I want to share with you, and we talked a little bit about stats and facts here, and I saw, Sarah, your face popping up. Am I getting close to time? No, I think I got some time still. You're good? Thanks. So I want to share a story. This is Angela. We met Angela about this time last year. She was coming up on her 58th birthday. And she had been just diagnosed with stage 4 lung cancer. Again, this time last year, she was hoping to make it to her birthday, honestly. It was about 3 weeks out. her symptoms had kind of stymied her health professional because she was health conscious. She never smoked. She's physically active, no history of lung cancer. She did all the things that we recommend people doing to have a healthy lifestyle. But she had heard that radon was a thing, maybe, and actually I'll pat MB Lungs on our collective back there. She had actually sat in a symposium like this a number of years ago and had heard about radon. So she went ahead and got a test in her home. And it was very high, some of the highest that the radon professionals in our province had ever seen. So she started spreading the word as much as she could in her hometown of Havelock, which is just outside of Moncton. Her neighbors, her sisters went knocking on doors and saying, my home is really high in radon. I want you to test yours too, because if it's in mine, it could be in yours. So we got in touch with Angela as we had a number of these radon test kit orders flowing in from the village of Havelock, and my colleague Leah, who runs this program, she said, where the heck is Havelock? Like, what's going on? All these test kit orders coming in. And so we got in touch and understood her story. And we asked permission from Angela to share her story and amplify it. And what we were able to accomplish in the village of Havelock last year was a community testing drive, where we got the village together. We talked about the health risks of radon. We had a number of donated radon test kits so that those that were experiencing financial barriers to testing their homes could do so. Frustratingly, there's still no provincial support in our province for testing or mitigation. This is an area that at MB Lung, we're really focusing a lot of our advocacy efforts. So here's a picture of Angela when she got out of the intensive care unit and came to her home to do just share some of her very limited time with us and share her story. Her full story is on our website in her own words. But what she wanted to accomplish in the time that she had left with us was to spread awareness of radon and make sure everybody has the information they need to protect themselves from this very serious lung cancer risk. Now, sadly, we lost Angela in April, but her legacy lives on in MB Lung. Here's some of the things that we're doing to raise awareness about radon. We're talking about it here. We're working towards our Atlantic-wide radon awareness campaign in the month of November. November has been deemed Radon Action Month by Health Canada, so we put a lot of resources there. It's also the greatest time to start testing your home because we start to close up our doors and windows. We test for a long period of time through the winter months because that's when you get typically your highest concentrations. Because when you have your doors and windows open, the radon tends to dissipate outside. So we have a number of radon screening lending kits in libraries across the province. We've accomplished that in the last year. And other public venues, we have a couple of MLAs who are hosting these kits. So this is just a screening kit. It's we use those electronic detectors for 2-3 weeks to kind of get a pulse read on what's going on. But really we want to do that long-term test before you make any decisions about needing to mitigate. We have established Angela's Allies Community Fund, where we have collected some donations to be able to provide these long-term radon test kits to those that are in financial need. You know, if the $60 plus HST is completely out of reach for someone, I don't want your finances to come between you and ideal lung health. We've also been working on a number of community testing events to gather a lot of high density radon testing data and using that in our advocacy efforts. You know, in the past, we've had that 2012 Health Canada study with 800 and some radon results across the province. It's a good snapshot, but it doesn't hit home as much as when we can say we've tested, 60 or 80% of the homes in this community, and here's what the results are in this community. So that's what we've been doing lately. So we want to keep Angela's legacy going. We probably speak her name every single day here in our office, and I want to continue to do so. As part of Angela's Allies last year, we have tested close to 1,000 homes in the province. We want to keep that momentum going. We do have a QR code there if you are in a position where you think you can contribute to this initiative. By all means, please donate. And with that, I will take questions. I think we're still ahead of schedule. That's great. And I talked a lot. Can take some questions, and then I'll just leave this slide up if you want to get in contact with us after today. Anything to do about radon, here's all of our contact information. And like I say, large scale radon campaign hitting social media here in the next couple of weeks.
Thank you, Melanie. We do have a question from Charlene, and I wasn't trying to cut you off earlier. I apologize. Charlene asks, is there a lab test to confirm radon levels in the blood for lung cancer patients or suspected patients?
Not that I'm aware of, because it doesn't stick around in the blood. It's more that the damage happens in the lungs. Now, we are pretty excited that there's a new lung cancer screening that was just rolled out in the province, I think just last week. That'll be a less invasive and hopefully more accessible screening tool for the risk of lung cancer, but it's not a blood test.
Okay, and we don't have any more questions yet, but we are a little ahead of schedule. So if there's anything you wanted to add, I will just say to the attendees that radon has been something I've learned a lot about since I've been here and had my house radon tested. And one of my fears was the mitigation costs. So it was nice to find out that it's not nothing, but it's not as scary as I thought it was going to be. Fortunately, I don't have to get mitigation, but just so people know that that's not as bad as they may think.
Yeah, that's a great point, Sarah, and thanks. And I will take where we have a few minutes. I'll speak a little bit about that. What is mitigation? What does it mean? What are we talking about? So the repairs that you can do to a home to get the radon out is essentially there's a certifying body that certifies contractors, and we've got 7 or 8 certified contractors here in New Brunswick. They come in, and lots of variability there depending on the construction of the home, but in a nutshell, they provide a pathway for that vapor to, instead of coming through your basement floor, to be intercepted and dispersed out to the outside. So for lots of homes, that looks like pipes beneath the slab and a fan, and the fan sucks from the pipes and dumps it outside. For some houses, that's more complicated, so that can be a little bit more expensive. For some houses, that if it's a newer build house, it's actually in the National Building Code to include a rough-in for that system. So the pipes beneath the slab are already there. All that is needed is that we add the fan in the outside part so that it can suck and dump it outside. So typically the mitigation costs in this province, again, talking to a number of contractors, yes, there's a range, but on average it's between $2,500 and $3,500. Takes a day to do, and those radon levels get reduced by up to 80% in less than 24 hours. So it's very, very, very effective, minimally intrusive, and there's no maintenance required. So once that pathway is there, the radon vapors will come up and they'll follow the path of least resistance, and they'll just be continually dumped outside. So it's a one-time fix and you're done. So we certainly don't want people to be too scared about it. It is, it's not nothing, like Sarah said, but it's something that perhaps you can plan for in your budgeting going forward. We are working on some advocacy efforts to include some supports for that mitigation cost, because again, we never want finances to be a barrier between folks and their lung health. But at this point, the support for the cost of mitigation is exceptionally limited in this country.
Thank you. I know one of the things that we get asked by people when we're at events about radon is, what if I don't live in a house? What if I'm in an apartment building or some kind of a leveled arrangement? What should I do then?
Mm-hmm. Yeah. This is great, Sarah, the frequently asked questions. So with rental properties, the nuances get a little bit sticky. It's not as clear ultimately it's the building owner that's responsible for it. So I certainly encourage everyone to test the space that they're living in, whether or not that landlord and that property owner will take the actions is a whole other kettle of fish. But it's not to say that that you shouldn't look at it. So for folks that live in, if you live on the 4th floor of an apartment building, chances are you're not going to have very much radon. It's a really heavy gas, so it tends to be at its highest levels in basements and ground floors. But those that are living in contact with the ground can always do a test. What's important is to know what you're breathing in so that you know what your individual risk level is.
Thank you. And as Melanie mentioned, if you have radon questions, we do have our colleague Leah who does work in that department, and she is frequently answering questions, so feel free to reach out to us. So if there's no further questions, thank you so much, Melanie, for your time. We appreciate your thoughts and information. Yeah, thank you.